This is the visual field of healthy human eyes. Usually the viewing angle of one eye exceeds 150 degrees and may exceed 180 degrees with the binocular collaboration. One of the symptoms of retinal pigmentosa is to irreversibly gradually reduce the visual field of the human eyes. The more serious problem that comes with it is that there are basically no drugs and surgical methods that can treat retinal damage. Due to the powerful image compensation ability of the human brain, it is difficult to detect the slow loss of visual field. Therefore, various subdivided RP diseases are often diagnosed only if they have seriously affected the normal life of patients.
之前他就是回香港去工作以后，我看到回来之后走路为什么呢？总是碰到东西，我就 push 他去检查眼睛，结果呢，他就在香港那个很大的医院去找个眼科医生去检查，经过检查以后，证实就是 RP， 结果是没得治。
The patient we interviewed was diagnosed after being urged by his family 8 years ago when his walking was even affected. When he finally began to take eye acupuncture treatment from Dr. Wang, his remaining visual field of each eye was even only 10%. Speaking of the illness, the mom has accompanied her son to the treatment for many years, is feeling very emotional.
之前都要坐那个私家车去上班的，下班的时候天黑了，我叫他带一个手电筒，打亮了以后才可以再安全一点嘛，因为你看不人家，人家也看不到你，就这几年都是很好，还不错，没有那个碰碰撞撞的情况再出现。
您说碰碰撞撞就是走在路上，有的时候旁边人擦身而过，他看不见哈，就会跟人家
滑的地方比较宽一点，就是擦身而过，常常就碰到眼睛也去 emergency 缝针，眼睛也打碎，哇，好可怜，我听到心也碎了。很难过。当时的情况他都没有说出来，是我的多他应该告诉我的。现在这个情况没有再出现。
For all kinds of retinal or other internal eye diseases, Dr. Wang's most powerful solution is to use the remote microacupuncture method combined with direct needling and eye acupoints. Among them, only traditional Chinese medicine needle are needed to operate microacupuncture. Microacupuncture was launched by a Danish doctor in the 1980s. It was not originally studied specifically to treat eye diseases. Rather, feedback was given incidentally in some palmoplantar treatments, after which a total of 48 stimulus spots on the hands and feet with nice results on vision problems were progressively summarized. Tracing back to the source, this treatment method using distal limb stimulation has corresponding detailed records from the Huangdi Neijing. Huangdi Neijing Lingshu Genjie detailed Gen and Jie of foot Sanyang meridian and foot Sanyin meridian, which means the beginning and convergence of qi. These 6 meridians all start on the feet and 4 of them settle on the head. Biao Youfu from the Yuan dynasty mentioned, penetrate needle into the right side while disease in the left side. Needle into feet while disease in the head. Clinically, giving treatment on the opposite side is called corresponding needling. In TCM theory that man is an integral part of nature, each part can reflect the whole, also treat the whole. It's also viewpoint of holographic theory, which derived head needling, ear needling, palm needling, foot needling, and other various acupuncture methods. After the Song dynasty, theory of Tai Chi developed vigorously, which also promoted the formation of holographic theory. It is believed that any relatively independent part of the human body is the epitome of the whole body. They all make use of the close relationship between limbs, head, and body. It also shows that there is a theoretical basis for treating diseases in other positions through specific acupoints on the head, ears, and extremities. Compared to the microacupuncture with a more friendly size, the deep of deep needling is worthy of the name. Needling near the orbit, the core idea is to stimulate the acupoints around the eye socket, such as Jingming, to unblock qi and blood. Based on the need for direct access to the nidus, the deep needle will fit the eye curve as far as possible under the premise of safety. Penetrate into the back of eyeball at an angle of about 85 degrees and close to the retina as far as possible to improve the stimulation effect.
It's a long term. It's a long time. When you come for the treatment, you pretty much have several years, more than 10 years, somebody 20 years. What happened is for that long time, your cell damaged. There's lots of stagnations. When we do the acupuncture, oh, you have this pain, we can touch it, we can see it. But retinal one, you can't see it. You can't touch it. Damage area is on the retina. The closer to the retina, more powerful qi is reaching there. They are so powerful they can break the blood stasis there. A number of the patients after needling, they do have a bleeding. It's kind of like Chinese medicine. Sometimes we do guasha, we do cupping. We get the blood stagnation come to the surface. So the bleeding actually is a good sign.
Characteristic needles with specially trained acupuncturists, but anyhow, facing the fact that a needle close to 15 to 40 millimeters penetrated the eye socket, the patient's open attitude to actively cooperate with the treatment is also indispensable.
Retina is someplace cannot be touched. So any practitioner, when they practice this technique, the most important thing they have to remember, the needle cannot touch the retina.
So when Cheryl told me about the deep needle in the eye, at first I wasn't quite sure. At that point I was just having needles in my hands or feet. But after she explained how it worked, and she also explained the treatment has been done to her previous patients, then I just agreed to try it out. And the first time I did it a little bit different because the needle is going through you very slowly. Normally, when she put in needles on your hands or on your feet, they're super quick. You don't even notice it's already done. But for the eye, she would talk to me as the needle goes in and ask how I feel, and then I just provide feedback, and that's pretty much how it worked.
For the effect of Dr. Wong's acupuncture, the test report from the professional ophthalmic field machine we see now may be more intuitive. The circular grayscale diagram on the left shows the recognition ability to light by different parts of the retina within this eye. Higher the sensitivity of an area to light is, higher the brightness of the color will be shown on the report diagram. The large area of black in the report basically indicates that the visual field of the area has been lost. When we compared the reported data from the same eye of the same patient after taking acupuncture treatment for 4 days, the central range has recovered slightly, and the available range of the edge has also increased. The comparison report of another patient who had wet macular degeneration also recorded a similar situation. From April 26th to May 1st, the disappearance of the black part on the image edge means that the bleeding has stopped. Some areas even have exponential light sensitivity recovery of more than 10 decibels.
In Western medicine, why they say there's no treatment? Because they considered there are certain genes in your retina, the mutation is wrong. So how are you going to correct the mutation, right? In Chinese medicine, what we look at, any part of our body need nourishment. All the nutrients is from blood and qi. Then Chinese medicine through acupuncture promote the blood circulation, send the blood and qi to the patient's retina to nourish the retina so the retina able to function.
Since the 1960s, Dr. Xie Qi from Malaysia had quite a passion on studying medicine while still at school. He made great efforts to obtain scattered clinical experience of eye deep needling from the literature of the Chinese medical circle at that time. He also provides free treatment for patients frequently, just to explore and learn. After graduation, he began to systematically treat ophthalmic diseases with deep needling. In the past 50 years, he has not only helped countless patients with glaucoma, muscae volitantis, retinal pigmentosa, xerophthalmia, retinal edema, macular degeneration, and even close to blindness to achieve fundamental improvements, but also actively summarizes and imparts so that more acupuncturists can use deep needling to help patients safely. In addition to the optic nerve problems caused by a hereditary factor, a series of symptoms caused by high intraocular pressure such as glaucoma are also torturing a large number of patients. This time, we also interviewed a patient who had glaucoma, vision snow, and even systematic abnormalities after a monocular cataract. Before finding Dr. Wong, the solution he got was basically endless oral vitamins and eye drops.
I had what I called an eye attack. In 2020, it was winter in Winnipeg. I came back, super cold there. I noticed I would get panic attacks easily, like a sense of like doom. I admitted myself to ER like maybe twice that week. Whoa. Because I just felt like something was totally off. I believe it was right after I came back from ER and I went to sleep and I felt, oh, everything's okay. The doctors checked me. I woke up the next morning and something's weird. Everything looks blurry. So I have a cataract in my left eye and for several years, I know I have blurriness in my left eye, but I looked around, it's like I closed one eye and looked at my right eye. It's like, you remember my right eye is blurry now. Oh no, am I getting a cataract in my right eye now? And I noticed that when I stared at a white screen, the crispness of the white screen would just not as crisp and somewhat flickery. This is basically what I looked. My left eye, I could see a black sort of vortex come in, almost a blob that comes in and moves around and disappears every now and then, and it flickers. It almost flickers at a certain frequency. This ended up being visual snow, and you get other side effects like palinopsia, so like ghosting, like seeing a double, like an imprint of something. You look at something and you look away and all you see is the imprint of that person. I went to 5 different ophthalmologists that they look at my retina and they're like, it looks fine. So the general ophthalmologist gave me eye drops to reduce my eye pressures. It was dry and it burned a lot. I went on so many vitamins. I think my liver almost broke down. I'm not sure what it was. And I got to the point where I couldn't even sleep or stay standing for too long because I had to keep my legs up on the wall because I need to get the blood back into my heart, because if I didn't, then I would feel this. It's a feeling of impending doom. I think I almost probably died there if I didn't see Cheryl.
Vision issue. It's not just the vision, it's your whole body involved. So there are lots of people, you will see that they have a cold hands and feet. Their circulation on their hands and feet is not good.
TCM acupuncture were never on my list of things to think about. I come from a Western sort of upbringing, Western science. Our very first treatment was a very memorable one. She was gonna not treat my eyes first, she was gonna treat my, I think my liver or just my general health, just get me back to normal, my blood pressure, everything. I think she only did like 3 needles. When I was driving home that night, I can kind of guess and feel when that feeling is going to happen again. Yeah, wait for that moment. I got tense up, and then it's going to happen. But something was different there. It was more of like a manageable feeling. It came and then it was okay. And I can tell you from that treatment on was only positive things.
I decided to adjust his body, treat his whole body first, to get his blood pressure a little bit upper, and get his heartbeat a little bit upper before we treat the eye. Then we start a deep needling.
When a needle hits a certain point, I can actually feel massage-like feeling to it. It's hard to describe it. It almost feels good when it hits a right spot. The first spot, which is kind of a shallow spot, she'll hit that shallow spot and it'll feel, it feels, I think you got the right spot. But then she moves past it and goes further until she hits another spot deeper in. And then that one's like, oh my God, that feels so nice. It's like someone constantly massaging you in one spot to relieve a lot of pressure.
I think his glaucoma laser surgery lower a little bit his pressure, but his pressure is still on the borderline and up. He only had 4 times. The last deep needling, after the needle, he did have the bruises and bleeding. Lots of blockage, qi and blood blockage, and behind the eyeball.
When she started moving to my left eye, this is where, when you talk about bleeding, she took out the needle and immediately I could feel my left eye swelling up. There's blood basically just gushing around. So I think what she did was she released a blockage of, I don't know, bad blood or stale blood. That first 1 or 2 nights was probably the scariest. I wasn't too scared. And I think after the first night or something, it was fine. I could close my eyelid, and it took like 4 weeks for the blood to finally drain out of my left eye.
So in Chinese, we say qi xing, xue xing. So it sounds like when the qi moves, blood follows. But actually it's when qi moves, qi push the blood move forward.
One day I just decided at home, I'm just gonna lie down on the flat ground here, looking up at the ceiling, maybe my eye closed. I could feel my left eye falling to the back of my eye socket. Because if you think about it, with 28 mmHg for however many years, you've expanded your eye socket and the surrounding tissue around it to fit that big eyeball. Now it's getting smaller. What's it gonna do? It's gonna fall back into the back of your eye like it's supposed to. After deep needling sessions, I can see further into the distance. There's less blurriness in general. When I look at a screen, it's a little bit more crisp. I'm not using any eye drops now. It feels so much better.
To sum up, the guiding theory of acupuncture in the treatment of eye diseases is to ensure and promote the blood circulation, send blood and qi back to the retina to push the blockade and stagnation out. In order to achieve that purpose, needles at the far and near ends can both play a good role and cooperation with each other. The patient with wet macular degeneration in the cell phone video we see now was more than 90 years old at the time of shooting. After 2 days of comprehensive acupuncture treatment by Dr. Wang, he had recovered to the condition that can see the small words clearly on the receipt from a standard severe central vision loss.
Here's my meal ticket. I can read the amount right there. I can see it. $17.84.
Wow.
This is the first time I was able to do that in I don't know how many months.
Wow. I'm so happy. Are you happy?
I'm happy.
For a long time, the common view in acupuncture teaching is that eye needling should not go deep. But in fact, the acupoints around the eyes are not only defined in the shallow layer by classic books. It was only times and technologies which had people limited. With the development of modern material technology, today's TCM doctors have freely selections on needles' length, diameter, deflection, and other indicators. The needles have handles with excellent hand feeling, which will not deform easily. At the same time, the needle body is thin and sharp enough, which is difficult to be broken and can penetrate smoothly and will make needling with radian more reliable. Compared with the original materials, such as bien stone thousands years ago, these new gradually advanced needles are extending the use case of acupuncture and giving new vitality to this time-honored medical technique.
抽你個 DNA，抽上去，支嗰處眉嗰處花樣，然後做所謂脈絡膜缺失症。
其实就是 Retina Pigmentosa。
只会传给女孩子，男孩子没有的，这个要验那个 DNA 才知道的。反正我有一个外甥女啊，她是女孩子嘛，是我女儿的女儿，也有25% 的机会看着她跟进 follow up。
跟进
不一定就是25%没，所以现在知道吗？事业没得知吗？我就中意控制着这个 moment， 这个 moment 就不会像我儿子现在这个样子了吗？
From their experience, we can also recognize the potential genetic risk of ophthalmic diseases. Just like how each subdivision of RP may represent different genetic characteristics in each different patient. For example, some people only pass on to children of a certain gender, while some will show alternate generations of inheritance, and so on. Therefore, it is undoubtedly a very wise choice to give early follow-up attention to the next generation. In the same way, for all patients, diagnosing as soon as possible after symptoms appear and using acupuncture for immediate control is also able to maximize the treatment effect. The first patient we interviewed was diagnosed with 20% of visual field left, which could be defined as disabled, and loss of working abilities in Hong Kong. But with timely and effective intervention to prevent deterioration, at present, except that he can't have a driver's license and needs to be more careful when walking, his work and life are still running normally. In fact, quite a few of these legally blind patients are not directly developed into total blindness. They often have to say goodbye reluctantly to their former life, step by step in the process of seeking for medicine with little effect when it is difficult to be diagnosed or treated. Which is also necessary is to maintain a good mood. For treatment, patients can accept what happens in their body so they can face it with a more positive attitude, and the effect of treatment may improve more.
all the way down to the finger.
I can feel all I can still feel.
That's probably why these two patients are willing to talk with us. The open and positive attitude led them to acupuncture. They made an attempt that seemed to require great courage, and were willing to share their experience to benefit more people.
The past few years, everything I think stable is good. 最近呢，他的心情比较轻松。他开始有这个病的时候，他不让别人知道的，他现在可以公开的，对他来说也是好事。
Like I said, I really don't like needles, but I know I have to do it. I know I have to do it, because if I'm gonna watch my son grow up, get married, have their own kids, live his life. I need to have healthy eyes. This is a must. I must be doing